The presentation on good regulatory practices in the regulation of medical products is based on the WHO Technical Report Series Guidelines 1033 Annexure 11 published in the year 2021. The content of the presentation includes background, definition, purpose, scope, objectives, overview of regulatory systems for medical products, principles of good regulatory practices, enablers of good regulatory practices, and implementing good regulatory practices. Background: the regulation of medical products has become increasingly complex with the globalization of product development, production, and supply, and the rapid pace of technology and social change in the context of limited financial and human resources. The importance of robust regulatory systems was recognized by the 67th World Health Assembly when it endorsed Resolution WHA 67.20. Regulatory systems are an essential component of health system strengthening and contribute to better public health outcomes. That regulators are an essential part of the health workforce, and that inefficient regulatory systems themselves can be a barrier to access to safe, effective, and quality medical products. A sound system of oversight requires that regulatory authorities be supported by an effective framework of laws, regulations, and guidelines, and that they have the competence, capacity, resources, and scientific knowledge to deliver their mandate in an efficient and transparent manner. Definition: good regulatory practices can be defined as a set of principles and practices applied to the development, implementation, and review of regulatory instruments, laws, regulations, and guidelines to achieve public health policy objectives in the most efficient way. Successful application of good regulatory practices is the hallmark of a modern, science based, responsive regulatory system in which regulations are translated into desired outcomes. GRP provide a means of establishing and implementing sound, affordable, efficient regulation of medical products as an important part of health system performance and sustainability. The nine principles presented in this document: legality, consistency, independence, impartiality, proportionality, flexibility, clarity, efficiency, and transparency are relevant to all authorities responsible for the regulation of medical products, irrespective of their resources, sophistication, or regulatory model. The purpose of this document is to present the high level principles of good regulatory practices. They are intended to serve as benchmarks and thereby guide member states in applying good practices in regulation of medical products. This document is also meant to guide member states in prioritizing the functions of their regulatory system according to their resources, national goals, public health policies, medical products policies, and the medical product environment. These principles based documents will be supplemented by practical guides and tools to facilitate implementation of GRP by organizations responsible for the regulation of medical products. This basic document is complemented by related guidance on best regulatory practices, including good governance practices, good reliance practices, good review practices, and quality management systems for national regulatory authorities. The group of documents is intended to provide regulatory authorities with comprehensive guidance on improving the performance. The scope of this document presents principles and considerations in the development and use of the regulatory instruments that underpin regulatory activities. Broader practices and attributes are presented that define well performing regulatory systems for medical products. The document is relevant to all regulatory authorities, irrespective of their resources, maturity, or regulatory model. High level GRP principles are equally applicable to supranational, for example, regional, national, and subnational regulatory systems, and systems in which several institutions are charged with regulating certain products or activities in a country or jurisdiction. The document is also intended for a number of related audiences, institutions, and policymakers responsible for formulating health policies, laws, regulations, and guidelines, institutions that together form national or supranational systems for regulation of medical products, and regulatory networks and parties affected by or otherwise interested in regulatory frameworks, such as industry or other developers of medical products. The objectives of good regulatory practices are to ensure sound, effective regulation of medical products as an important part of health system performance and sustainability. If they are implemented consistently and effectively, they can result in higher quality regulation, better regulatory decision making and compliance, more efficient regulatory systems, and better public health outcomes. They help to ensure that regulatory systems remain up to date as the technologies and systems in which they are used continue to evolve in an increasingly complex interconnected regulatory environment. GRP also promote trust among regulatory authorities and other stakeholders such as industry, academia, research centers, and healthcare professionals, and thereby facilitate international cooperation and the adoption of more effective and efficient approaches to ensuring the quality, safety, and efficacy of performance of medical products in the global regulatory community. The ultimate aim of GRP is to serve and protect public health and patients' interest with respect for all applicable ethical principles. Overview of a regulatory system for medical products. The figure illustrates architecture of a regulatory framework. What is regulatory framework? The regulatory framework is the collection of laws, regulations, guidelines, guidance documents, and other regulatory instruments through which a government and a regulatory authority control particular aspects of a specific activity. Laws define mandate of regulatory authority, define the authorities for making regulations, state what behaviors are authorized or prohibited with respect to products, personnel, and actions to be controlled. It is enacted by legislative branch of the government. Coming to regulations, it states at a high level conditions to be met. For example, responsible authority may issue market registration if sufficient evidence of safety, efficacy, and quality. It is also enacted by executive branch of government. Guidelines and other guidance documents provide detail on how the conditions may be met. For example, what is considered sufficient evidence, provide flexibility and adaptability issue by regulatory authority. This slide illustrates the principles and enablers of the good regulatory practices and the components of a regulatory system. Nine principles and enablers are listed in the table presented and are discussed in subsequent slides. In the overall regulatory system, three components inputs contribute most to regulatory functions and activities. Number one, the regulatory framework, composed of the legal framework, laws and regulations, guidelines, and other guidance documents. Number two, regulatory institutions, which may be represented by one or more entities, including the National Regulatory Authority, the National Control Laboratory, Pharmacovigilance Centers, and Research Ethics Committees, and all types of resources, including human and financial infrastructure and equipment and information management system. The regulatory outputs depend on the functions and activities concerned. For example, regulatory and marketing authorization, inspection, and assessment reports. The concepts and principles of GRP apply to the overall regulatory system. For application and implementation of GRP, several enablers are essential. When the principles of GRP are properly implemented through the enablers, the desired regulatory outcome and impact can be achieved. Principles of good regulatory practices, legality, regulatory system, and the decisions that flow from them must have sound legal basis. The regulatory framework should provide the necessary authority, scope, and flexibility to safeguard and promote health. Delegation of power and responsibilities to various levels of the regulatory system should be clear and explicit. The regulatory authority must be held accountable for its actions and decisions to the public, those regulated, and the government within a legal framework. The principle of legality requires that a regulatory system be structured such that all regulatory actions and decisions are based on clear legal authority, thus respecting the rule of law. Consistency. Regulation of medical products should be consistent with government policies and legislation and be applied consistently and predictably. Regulatory requirements should be implemented and enforced consistently for all medical product sectors and stakeholders. Consistency in regulatory actions and decisions is ensured when the same or similar circumstances lead to the same or similar outcome. It is therefore important that the regulatory system build an institutional memory by recording decisions to ensure similar fair treatment in future situations. Consistency is also ensured by sufficient clear regulatory guidance based when possible on international guidelines, orientation and training programs for staff, and regular transparent interactions with the regulated parties and other stakeholders. For example, industry associations, patients, healthcare professionals associations, and other relevant government institutions. These are the mechanisms for improving process and for the identification and resolution of issues. Independence. Institutions responsible for regulation of medical products should be independent. The regulatory system must operate and be seen to operate in an independent and authoritative manner, discharging its duties independently from politicians, government, and regulated entities. Regulatory activities and decisions should be free of improper and undue influence of stakeholders. Impartiality. All regulated parties should be treated equitably, fairly, and without bias. Regulatory activities and decisions should be free of conflict of interest or unfounded bias. The regulatory system must operate impartially. Regulatory decisions should be based on science and evidence, and the decision making process should be robust according to defined criteria. Proportionality. Regulatory oversight and regulatory decisions should be proportional to the risk and to the regulator's capacity to implement and enforce the decisions. Regulatory oversight should be adequate to achieve the objectives without being excessive. Regulatory measures should be proportionate to the risk of the product or activity or service. Assessment of medical products should be based on a benefit risk evaluation and continuous monitoring of the benefit risk profile in a robust vigilance system. Continuing with the principles of the good regulatory practices, flexibility. Regulatory oversight should be flexible in order to respond to a changing environment and unforeseen circumstances. The regulatory system, including its frameworks, should provide sufficient flexibility to reflect or respond to changes in the regulated environment, such as evolving science and technology. The regulatory system should be prepared to provide timely responses to urgent situations such as public health emergencies and shortage of medical products. The language of regulation should reflect performance when possible, allowing for alternative approaches to achieve the same result. The regulatory system should provide the flexibility for applying good judgment. Clarity. Regulatory requirements should be accessible and understood by users. Consultation, education, and training in new requirements contribute to clarification and compliance. The process and basis for taking regulatory decisions and enforcement actions should be clear. Efficiency. Regulatory systems should achieve the intended results within the required time and at reasonable effort and cost. A sound regulatory framework, competent staff, and effective use of resources and information from other authorities are the key elements of an efficient regulatory system. Regulatory authorities should continually explore ways of improving efficiency in fulfilling their mandate. The efficiency of regulatory instruments and regulatory operations should be assessed with performance based indicators. Transparency. Transparency is the hallmark of a well functioning regulatory system and is essential for building public trust and enabling the international cooperation. Transparency requires investment and a culture of openness supported by government policy, commitment, and action. Stakeholders should be consulted in the development of new or revised regulatory instruments. Regulatory requirements, processes, fees, assessments, decisions, and actions should be as accessible as possible. Enablers of good regulatory practices. An enabling environment facilitates successful implementation of GRP. Some elements are described in this slide: political and government wide support, Sustained support at the highest political and government levels, including policymakers, is essential for proper implementation of the concept and principles of GRP. GRP should form an integral part of all government policies on regulatory systems and be backed by strong political support. Effective organization and good governance supported by leadership. The structure and line of authority among and within all institutions in the regulatory system should be well defined. The integrity of the overall regulatory system is critical to the efficient performance of each of its constituent institutions. If more than one institution is involved in the regulatory system, the legislation or institutional regulation should provide for clear coordination and no overlap of regulatory activities. Leadership is critical for setting and realizing the organizational vision, mission, policies, and strategies, which in turn significantly contribute to organizational efficiency. Inter and intra organizational communication, collaboration, and coordination. Adequate effective communication plays a fundamental role in the exchange of information within and outside the institutions that form the regulatory system. When regulatory authorities communicate regularly, both internally and externally, they remain more transparent and accountable. Communication of correct information prevents potential misunderstandings and dissemination of misleading information to patients and the public. Communication is a powerful tool for collaboration and coordination with relevant national and international stakeholders, which leads in turn to efficient use of resources and better regulatory outcomes. A robust, well functioning quality management system. A quality management system, which includes application of quality risk management principles, makes the decisions of regulatory authorities more credible and their operations more stable and consistent. Continuing with the enablers of good regulatory practices. Sufficient sustainable financial resources. Investment in a regulatory system is critical to a well functioning healthcare system. Adequate financial resources to fulfill its regulatory mandate effectively and to improve the performance of regulatory activities continuously are essential for independence, impartiality, consistency, and efficiency of a regulatory system. The financial resources of all institutions of the regulatory system should be sustainable. Competent human resources. An array of technical and scientific knowledge and skills of regulatory staff contribute to the development, implementation, and maintenance of an effective regulatory system for medical products. Policies and measures for personal and career development, for example, training program, competitive remuneration schemes, are critical for regulatory authorities to attract competent staff and retain them in the service. Organizational ethics and values. Regulatory personnel should abide by organizational ethical principles and values and show professionalism. All regulatory staff should be made aware of and be trained in the ethical principles and values of the regulatory authority, for example, a code of conduct. A system should be established within or outside the regulatory system for managing departures from organizational ethics and values. Science and data driven decision making process. Regulatory decisions and decision making should be based on scientific foundations and accurate data rather than intuition or arbitrariness. Science based decisions provide for consistent, predictable regulatory outcomes. Adherence to international standards and guidelines is a key enabler of science based regulatory decision making. Implementing good regulatory practices. All regulatory agencies are encouraged to implement good regulatory practices in their regulatory systems with due considerations of the realities of their legal and regulatory systems. Transparent, predictable processes should be used to ensure high quality regulatory oversight that achieves the intended objectives while minimizing negative impacts and cost. At the same time, regulatory systems should be sufficiently flexible for processes to be applied proportionately to the scope, magnitude, and complexity of the issue. Sustained support at the highest levels with adequate resources is essential. Thank you for your kind attention.